قسمت انگلیسی رو شروع می‌کنیم. Good afternoon, ladies and gentlemen. My name is Samira Ardalan. I am a medical student and I am the moderator of today's online conference, joined by many prominent Iranian medical doctors, physicians, surgeons, and nurses from Europe, America, Canada, and Australia. And today's topic is the coronavirus crisis in Iran. The doctors simultaneously participate in this online conference from 19 different locations in 8 different countries. In this conference, they will discuss the start and rapid spread of the coronavirus in Iran, future prospects and ways to counter it, and they will also respond to viewers and press reporters' questions at the end. Dear friends, it is my honor to speak before you, and I would like to thank you for participating in such a timely and informative online conference. I would like to draw your attention on to the role of the Islamic Republic Guards Corps, the IRGC, and the 3 major disastrous crimes that have taken place in Iran over the past few months. It was in mid-November 2019, during the Iranian uprising, that the IRGC forces opened fire on peaceful protesters, peaceful demonstrators, and they killed over 1,500 demonstrators, injured more than 4,000 demonstrators, and in addition to this, they also arrested 12,000 peaceful demonstrators who are still in jail. Shortly after the November events, the IRGC targeted the Ukrainian plane on January the 8th, 2020. And when the Iranian students and the families of the victims called for accountability, the IRGC and its elite started again arresting the students and the families of the victims, and they staged a massive campaign of lies to escape responsibility and to avoid, and they did not hand over the plane's black box to relevant international agencies to follow up the investigation. And now the spread of the new coronavirus, the COVID-19, is causing the death of a large number of Iranians. Iranians are dying by large numbers in Iran daily. The new statistic it was unfortunately confirmed today that more than 2,000 Iranians have died after contracting the virus. And the number of those who have been infected has sharply increased. And the virus has now reached the entire country, all the 31 provinces, and has now spread to more than 105 cities and towns. Again, the IRGC is suppressing, is covering up. So we do not have official numbers. The official numbers are do not correspond to the real numbers, and they are giving a different figure. They say that only 107 people died and that only 3,500 people have been infected. In reality, those numbers are not even close to the real numbers. As we said, unfortunately, more than 2,000 people died after contracting the virus. And I would like to underline the role of the Mahan Airline, a company which belongs to owned by the IRGC. It was responsible it spread the virus from China to Qom in Iran, and the flights never stopped from and to China. These actions of the IRGC clearly prove that the Islamic Republic of Iran does not want to halt the crime against the Iranian people, nor can manage and overcome this crisis. Therefore, it is the international community responsibility to intervene on the basis of principle R2P responsibility to protect and not allow this inhuman regime to cause the death and cause the death of other Iranians. I urge the international community to condemn these massive violations of Iranian people's rights by this medieval regime and call on them to stop the IRGC crimes against the Iranians. Thank you. We are now, please allow me to introduce now our first speaker. Our first speaker is Dr. Sina Dashti, infectiologist from Sweden. Please, Dr. Dashti, the floor is yours.
Dear friends, ladies and gentlemen, it's an honor for me to be part of this gathering. We face a challenge as the virus has spread to most countries. We Iranians are about to lose lots of our friends and family members to this epidemic. That's the sad fact. The main difference between the situation in Iran and all other countries is that Iranians are fighting with two enemies. One is COVID-19 and the other one is regime. Transparency, engagement, humility, and inclusion are what makes a country's response to an epidemic outbreak effective. In Iran, newspapers and media were not allowed to report on anything that could harm the image of a regime, including news that the deadly virus was sweeping through the nation. The Iranian regime worsened the outbreak of the COVID-19 by criminally denying the danger of avoid any adverse impact to parliamentary election in February 21st, 2020. Despite a brutal censorship on COVID-19, turnout was the lowest in a parliamentary election since 1979 revolution. The international community has lost confidence and trust in the regime, particularly after cracking down on recent nationwide protests in November and shutting down the Ukrainian commercial airliner on January 8, killing all 176 passengers. But overwhelming evidence shows that the cover-up has been deliberate, and beyond any doubt, it was ordered by highest level of the regime, and I mean Khamenei and Rouhani. The outcome is clear, and we are witnessing a sharp rise in numbers of deaths in Iran. As NCRI's President-elect Mrs. Rajavi said yesterday, the numbers of deaths has exceeded 2,000. In the meantime, the lack of medicine, shortage of proper protective clothes, gloves, masks, disinfectants, etc., causes death among healthcare personnel. It happens right in front of our eyes that companies linked to the IRGC makes a lot of fortune from this misery. For instance, a capsule of Tamiflu that cost 25,000 tumans 1 month ago now surpasses 1.2 million tumans, one single capsule. Basic gloves cost 5,000 tumans for a box of 100. Now they sell for 8,000 tumans for one pair of gloves. Also, it means 800,000 for the box of 100. Ordinary Iranians are contributing to supply these items for hospital staff. The government doesn't. Those who cannot afford to be at home and staying at home are facing more danger in this case, like street children, homeless people, and elderly, especially elderly, are in big danger. The Mullah's regime meets 4 of 5 criteria for a failed state. It cannot and will not do anything to stop this tragedy. It is simply too much for them to do. The only thing they care about is to keep their grips on power. In order to get rid of COVID-19, we have no option whatsoever but toppling down this regime. Thank you for your time, and I'm looking forward to your questions.
Thank you so much for your important contribution. Our next speaker is Dr. Masoud Maqsoodi, a pharmacist from Michigan in the USA. The floor is yours.
Hello, my name is Masoud Maqsoodi. I'm joining you with my wife, Afsana Begi, MD OBGYN from this pharmacy. And I would like to say hello to all the audience that we have. And as we all know, coronavirus started from China. They quarantined many of their cities to stop the spread of this disease. But the Iranian government did not take any positive action to fight the virus. First, they did not announce it to the people. Second, they did not stop the flights to and from China. And thirdly, they did not quarantine the city of Qom, which they had the most infected people. Now that the virus has spread to most cities, Khamenei says, we have seen worse situations. People should pray, it will go away. This regime is incapable to do any good for our country. With a little rain, flood will destroy many villages, and with a small wind, sandstorm will cover most cities in the south. And now with coronavirus disaster is going to happen for our people. The Iranian people should take control of this situation in their own hands. And a lot of people go to pharmacies to buy masks and hand sanitizers and medications. I ask all my colleagues in Iran at the pharmacies to educate people in how to prevent this virus. And one of the best ways of prevention is to isolate the people who are infected. They need to be identified and not to be in contact with others. We condemn the Iranian government's inactivity for this mass infection and many dead people and worse yet to come. We ask the World Health Organizations send a group to Iran to investigate these situations. And we ask World Health Organization to send masks, hand sanitizers, and whatever people need to Iran and give it to doctors, nurses, and pharmacies, and do not give it to the government. We ask the international community to get involved and save the lives of our political prisoners and free them and to join their families. And there are a couple of questions that at the pharmacy, some people are asked us that were very important. One is the people who are infected after being treated, can they still spread the disease? Currently, CDC guidance to release someone from isolation requires fever-free without taking any medication, no symptoms including cough, and tested negative on 2 consecutive respiratory specimens collected at least 24 hours apart. The other question is, can coronavirus be spread through food? Coronavirus are generally thought to be spread from person to person through respiratory droplets. Currently, there is no evidence to support transmission of coronavirus associated with food. But it's important to be aware and wash hands before eating, and always wash your hands with soap and water for 20 seconds. Some ways to prevent this disease is avoid close contact with people who are sick, avoid touching your eyes, your nose, and with your mouth. Stay home when you're sick, cover your cough and sneeze with a tissue, clean with a disinfectant, frequently touch objects and surfaces. And follow the CDC's recommendations for using a framework. Thank you very much for the time you give me, and I hope that people in Iran can see freedom and overcome this problem that we have.
Dr. Maksudi, thank you. Thank you for your important contribution. Our next speaker is Dr. Masume Taheri, rheumatologist from Bergamo, Italy.
Good afternoon. Good afternoon. My name is Masume Taheri. I'm a doctor. I'm specialized in rheumatology, and I'm working in a hospital which is situated in Lombardia, in Italy. As you know, the Lombardia is in a red area, and we have many cases, 5,884, and 233 people died. So my hospital, for handling like others this situation, has created a different department to focus on infected patients only. And I'm working with this patient. The Italian government have taken the measure to inform the people, some authorities measure how to inform the people, how to handle, how to deal if they are infected, and how to prevent the spread of the virus. Unlike the Iranian regime, Iranian regime had been handling the situation in a responsible way. For example, when the first infection has been spread in Iran, has been seen in a city of Qom, actually a quarantine was not put in a place. No tests were done. Flights from China, especially Mahan, from China to Iran were not stopped. And they hidden all the information regarding the cases of corona and the scientific explanation of the symptom of this virus. So they did not close immediately the public areas like such a hospital and schools, schools. This disruption of transparency is a betrayal of the trust between the Iranian government, the Iranian regime, and the Iranian people. Rouhani and Khamenei are responsible for putting Iranians' life at risk. Even politically prisoners are in danger. So I would like to ask the international community to condemn the action of the Iranian regime and call for the liberation of the current political prisoner in Iran. I want to thank you for giving me the opportunity to talk with you. Thanks very much.
Dr. Taheri, thank you very much for your important speech. Our next speaker is Dr. Ali Zahedi, general physician and dermatologist from Australia. Please, the floor is yours.
Thanks for the opportunity. And I'm very pleased to be part of this gathering and team. My colleagues have managed to touch base on part of the aspects of the shortcomings of the regime and the hardship our people are going through. I just try to add, I try not to repeat what has already been mentioned, add a few points to what has already been mentioned. As you know, our colleagues in Iran are going through a very hard situation, difficult situation. They are having the shortage of supply and supply of medicine, supply of power, protective measures. And in spite of that, they all have accepted to stay put and work hard and safeguard the safety of the patients, the victims of the coronavirus, while the regime has been neglecting the effect of the virus on people for the past nearly 4 months, just pleasing its own agenda and forgetting about the people. This has been the habit of the regime for many years, for nearly past 40 years, and is already continued. The bottom line is that we would like to ask the international community, especially the WHO, the Security Council, and other relevant authorities to take active steps to bring the catastrophe under control by holding the Iranian regime accountable for its cover-up and failure to act. I just give you a quick sample of what is happening in Iran. At the moment, based on the regime's statistics, there are 194 people dead to the virus, and 6,566 people are already carrying the virus that are diagnosed. Based on the latest epidemiologic calculation, as partly mentioned, for every diagnosed patient, there are 80 to 100 undiagnosed victims of the virus who are carrying the virus and are spreading it. The regime is not caring about any of these and is not even interested in collecting the numbers. By a simple calculation, based on what Anna said, there are more than 500,000 people already infected. The NCRI, the National Council of Resistance of Iran, based on its own credible internal information, has managed to come up with a number of more than 2,000 fatalities, which are a lot higher than what the regime is accepting. And if we take into account this number and included in our calculation, I believe that already more than 1 million people are infected. So we are facing a near catastrophe in Iran, and the regime is neglecting it. I wanted to quote some of the Iranian parliamentarians from Rasht and from Qom, quotes that how desperate the situation is in Iran, and the Iranian regime has nearly left the country alone. One of my colleagues referred to the quote that Dr. Minu Mahar is one of the members of the committee that is supposed to prevent infectious diseases, who came up and mentioned that ultimately 40% of population will be infected, and then the virus will come under control. This is just like raising your hand in front of the virus and leaving your population defenseless. This is disaster. This is criminal activity. This is a crime against humanity. The reason this is happening is rooted to the failure of the regime in the past 40 years. The lack of transparency, cover-ups, spreading misinformation, misleading its own population, misleading the medical staff, not telling them what's going on, and more important than that, misleading the international authorities, including the WHO. And the regime has been prioritizing its own agenda, which has been its celebration, its election, and its nuclear activities through these times. And we are worried that there might be something happening behind the curtain in any of these aspects as well. So corruption is another issue that has been entrenched in the system and is now impeding any sort of activities being from international world or being from the internal cooperation by the groups. So nothing is going to get better in Iran, unfortunately, while the situation is as it is. Iranians, as my colleagues also mentioned, are fighting two viruses. One is the fundamentalist dictatorship ruling Iran and our country, and the other one is the biologic virus. So I believe that the first one is the more dangerous one, but at the moment the Iranians are facing both. In every normal country, usually people go behind their government and then put their hands together fight any disaster or shortcomings. But unfortunately, Iranians are left alone to fight both viruses on both fronts. On one hand, fighting the regime, and on the other hand, fighting the virus alone. At the end, I would like to thank my colleagues, the medical profession, who are really doing what they can do best and putting their own lives at risk, saving the patients as much as they can. Although we know that it's really a desperate situation in Iran and disaster is about to happen. The international world should wake up and see that what's happening in Iran will soon spread to the rest of the world, as is happening in Iran. Iran is number one in exporting coronavirus to the rest of the world at the moment. And if the situation continues as is, this is going to get worse, and the surrounding countries are in immediate risk of facing a disaster by this virus. Thanks for the opportunity.
Thank you for your important contribution. May I welcome Dr. Virginia Pishby, physician and specializing in microbiology. Please, the floor is yours.
Good afternoon to all of you, ladies and gentlemen, dear colleagues, friends. I'm Virginia Pishby, and I'm a doctor finishing my training in microbiology in Naples. I work in the Policlinico Federico II, but more than this, I'm preparing my thesis in the infectious disease hospital Cotugno. That is the forefront of managing the COVID-19 cases in Campania, in the south of Italy. In my experience, when I started to understand what was going on, I saw the situation from the beginning, that it was developing in different phases. The first one, the mechanism of infection of the virus have been misunderstood, and what the China make it known on the 13th of December was just that they were facing on new cases of atypical pneumonia. The first answer of China, the first answer of China and the first countries involved had been inefficient. And comparing, with the prevention of the infection. And third, the infection has taken by surprise all the countries. And from this point, it showed all the criticism within each nation. This, for me, is the most important point, because it shows how the nations, each nations, are doing something for achieve for all the population the right to health care. What I would like to talk about today is about this spreading out of the COVID-19 infection in Iran and the right to health care of the people of Iran. As we got the updating news from this country, the virus in Iran is even more concerning, and the situation over there is getting more and more alarming. We are observing that this issue had become a national disaster due to a number of factors, including keeping people uninformed about this the virus outbreak, the criminal cover-up trying to bring as many people as they can to the fake elections, and the total lack of health aids for the population, and even more worrying, the absence of this health aid and instrument insufficiency for the medical crews in the hospital, due to the monopoly of the RGC over the health products and services. And so, because of this lack of hygiene and lack of any preventive measures, that has given exponential rise in the number of fatality. This is unacceptable. How can we face also a virulent infectious disease without instrument? For them who have the responsibility, the frontline fighters of this outbreak, doctors, nurses, and other healthcare providers who have been fallen victims of this regime criminal negligence and the RGC monopoly. Based on the information that we have received, the analysis of the sources, including a reported spread of virus from Iran to other countries around the world, the number of fatalities in Iran is in an order of magnitude more than what officially has been declared. Although the death ratio of those diagnosed with COVID-19 in Iran is far higher than average. Independent reports suggest that the death, as you say just a few minutes ago, is more than 2,000 in Iran. My colleagues have spoken, and the colleagues that will speak after me about the dimension of this outbreak in Iran. Even China, that said that the spread of coronavirus had started from there, but now says that some new cases that tested positive for COVID-19 are coming from Iran. So I want to just say that what is the propaganda from this Iran regime doing is that what the regime is not only putting so high risk the population of Iran. They are turning the Iran as epicenter for transmission on the virus of vast parts of the world. So concluding, I will just say this, that as always, where there are no social and political rights, as Iran with this regime, the right of healthcare to have a healthcare is always missing. So I therefore express my support for all the physicians and healthcare providers who are risking their lives and trying to save other defenseless citizens and trying to cope with 2,000 deaths due to the coronavirus. Thank you all, and good work to everybody.
Thank you, Dr. Pishbin, for your important contribution. Our next speaker is Dr. Kimia Shahverdi, pharmacist from Germany. The floor is yours.
Good evening, everybody. Yes, even if the matter is taken seriously in Germany, the atmosphere is largely very optimistic because the state can provide medical and social resources to the people. In this regard, so far, for example, the German government has banned the export of medical protection equipment so that the medical personnel can continue to use the hygiene products that have been proven to offer the most protection against infection. It is sad to see how countries in which there is a dictatorship, the dictator leave their own people in fear and horror. Over 2,000 people have already died in Iran. Moreover, because of the inaction by the officials towards the citizens and fellow human beings, the corruption in providing masks, disinfection solutions, and gloves. The number of infected people increases to tens of thousands. I feel so sorry for the people of Iran and political prisoners who are victims of Mullah's regime lies and cover-ups. The systematic Mahan airline flights to China resulted in bringing the coronavirus into Iran, the city of Qom. This airline, as we heard, belongs to the IRGC, the Revolutionary Guards Corps. Yes, they are also responsible for the mass killing of innocent people. Yes, also they reject to build quarantines in Qom, which caused that the coronavirus is spread to other cities. Yes, and now officials also acknowledge the infection has reached to 31 provinces. It is the utmost importance that the people are given these infections in medicine to deal with both mild and severe cases of infection, especially because it is simple and inexpensive. For that, I call upon the UN and the international community to help the Iranian people directly and independently. Yes. So I hope that was it.
Thank you, Dr. Shahverdi, for your contribution. We have now a few questions. The first question is for Dr. Sina Dashti. The question is from Mr. Masoud Al-Kag from Al Arabiya. I read the question. Why do certain Iranian authorities, including the commander of the IRGC, talk of biological offensive when they want to mention coronavirus spread?
Well, I think the IRGC wants to deny its role in the cover-up of this disaster. For a week ago, one of the known Iranian professors at the Tehran's infection department said that the number of people who get infected it's about to rise about 40% of Tehran population in the next 2 weeks. And yesterday, one of the well-known Professor Minu Mohrez said the same thing and confirmed that number, that almost 40% of the Iranian people are going to get infected by this virus in the next 2-3 weeks. When we are talking about these proportions of these numbers, then we have seen the depth and violence of the tragedy that we are witnessing now. And of course that IRGC wants to, as always, wants to blame someone else. So no one takes it seriously. The origin of this virus is quite clear. The Chinese government says it comes from China, and they know they did everything to prevent that. So no one takes them seriously in this claim that is biochemical warfare by any other state. It's just their own failure, nothing else.
Thank you very much, Dr. Dashti. The second question is made of two parts. The first part is for Dr. Ali Zahedi. The question is from Mr. Nazar Jab, Asya Sadeli, Kuwait. What are the most important consequences of the coronavirus spread in Iran on the regime in power in that country?
The regime at the moment is in a situation that has left the people alone and is minding its own business. We are worried that it might be developing some extra nuclear activities behind the scene under cover of the coronavirus. And as you know, the regime announced that they will bring around 300,000 teams of people under cover of medical support to the streets or to the doorsteps of Iranian people. But we know that they are in fact security forces. Iran is scared of uprising. I had an informal report today from Tehran that I cannot confirm, but just a preliminary report that some of the supermarkets in Iran are under threat and people are attacking the supermarkets for food and for supply. We know that the corruption in the regime is impeding the supply reaching people. It is impeding medical supply reaching hospitals and those who are in need. Regime is in a desperate situation. Of course, it's a very difficult environment at the moment. On one side, people have to deal with the coronavirus, staying indoor, not coming to the street, not protesting, not gathering. And on the other side, it has reached a level that basically is intolerable. I just read a quote from a Iranian parliamentarian, and that says that his name is the parliament deputy. His name is Abdul Karim Hosseini, who admits that the pile of dead bodies in Qom and helplessness of the people of Rasht are evidence of failure in notifying and alerting the people about the virus outbreaks in a timely manner. This is a parliamentarian in Iran selected by this regime, comes under so much pressure that is forced to confess to the failure of the regime. The regime is desperate. We don't see them, we don't hear about them, and those who come in are making fun of the victims of the virus and pretending, misinforming, and making the situation even more intolerable for people. The informal information, again, I have from Iran is that the situation is desperate and people are reaching their last drop of energy, but they haven't lost hope because there is a resistance. There are small groups of resistance. There are people who are well organized and well connected. So because of that, in spite of all of the pressure, I think people haven't lost hope. The way I see and I hear, I think that they're still standing on their feet and they're fighting for their survival and the survival of our country. Thank you very much.
Thank you. The second part of the question is for Dr. Masoud Maqsoodi. This is the question. In Iran, the supreme leader is the true decision maker. Can one correctly conclude that the first person bearing the responsibility for the actual spread of the virus in the country is the supreme leader?
Well, definitely. I think all the actions of the government is on his hand, and Khamenei is the one who is in total control of IRGC and all the fractions of the government. So nobody does any activity or anything in Iran without okay from Ayatollah Khamenei, which is the most responsible person for this situation. And that's how Iranian people that we talk to outside of the country and inside, that's how they feel.
Thank you. Thank you very much. We have reached the end of our conference now. I appreciate you all for joining with us, and I hope this program was useful to our viewers. Wish you all the best. Goodbye.